The reason that most people come into our office is because they're trying to recover from an injury or pain, or in an uninjured situation and they're trying to improve their sports performance or exercise. And unfortunately, I think a lot of people don't think about the nutritional aspects of recovering from injury or pain or improving their sports performance. And even more unfortunate, I think a lot of healthcare providers don't really bring up the topic, at least not in a meaningful way anyway. And so the purpose of this video is to outline some very basic nutritional needs that people have when you're recovering from an injury or pain, or when you're exercising or working out or trying to improve your sports performance. And I think the content might surprise quite a few people. Now, I guess in 9 times out of 10, part of our treatment protocol involves preventing muscle loss due to inactivity from an injury, encouraging the healing of a muscle or a tendon or a bone in the recovery process of rehab, or building the capacity of the whole system to perform optimally in a sport in an uninjured athlete. Now, in all of those cases, the major building block of bones and tendons and ligaments and muscles is collagen. And the major building block of collagen is protein. Therefore, the intake of protein is really important. And the best way to synthesize protein is through resistance exercises, but we also need to be eating enough protein to allow this to happen. So just as a quick example, I recently had a guy come in here with low back pain. We'll call him Sam. He had been to different chiropractors and physical therapists and was better, but not really like even close to what he wanted. And I looked at his rehab program that he had been giving, and it was actually pretty good. The exercises were pretty good. But when we started talking about his nutrition, his protein intake was really, really low. And so without really changing too many of the exercises, we really ramped up his protein. I mean, he thought he was having a good diet because he was eating a lot of fruits and vegetables and whatnot, and so he thought that was good, which it is. I'm not saying it's not, but his protein intake was really low. So we ramped up his protein intake and we changed just a couple exercises, but for the most part, it really didn't change that much. And his back pain that he had for years was gone within a couple months once we actually gave him the nutritional building blocks to build the muscle and the capacity of all the system to repair itself with the exercises that he was doing. So how much protein should you be eating? Well, the RDA for protein is 0.8 grams per kilogram per day, or since we live in the US, 0.36 grams per pound of body weight per day. So if you weigh 150 pounds, that would mean you should have 54 grams of protein per day. And when you consider that a 6-ounce chicken breast contains about 45 grams of protein, that all seems pretty easy. But is it? So let's step back for a second and realize what the RDA is. That is the minimum amount of a nutrient that you should be having per day. In a sense, it's the minimal amount that you should have to stop yourself from getting sick. It's certainly not the optimal amount that you should be having to function properly. The sports nutrition research is really clear on this. When trying to build muscle, the requirements for protein intake is much higher, doubling the RDA requirements in many studies, and in some studies recommending more than triple the RDA. 3 grams per kilogram of body weight would equate to 1.36 grams per pound of body weight, meaning if you weigh 180 pounds, you would eat a whopping 250 grams of protein per day. Now, similar to the requirements for sport, the requirements for protein intake during the repair and remodeling of muscles and tendons and bones during injury recovery and rehab, that goes up quite a bit as well. During the injury and rehabilitative phases, there's a stress response that initiates an overall increase in energy demand. And at the same time, when you're injured, there's this phenomenon called anabolic resistance, which basically means there's a reduced ability of your body to synthesize muscle protein during times of disuse or immobilization. And this increased energy demand combined with the anabolic resistance actually increases the demand for protein. Now, understandably, most people, when they're injured, they want to reduce their caloric intake because during this time of reduced physical activity, they don't want to gain weight. They don't want to put on fat. And that's totally understandable. But at a fundamental level, the role of nutrition when you're injured is to provide enough protein to reduce a loss of muscle mass and allow enough protein to heal the tissue. And so you have to actually increase your caloric intake without gaining fat. And that can be challenging. However, it needs to be addressed because it's well documented that immobilization results in a 0.5% loss of muscle mass per day, accompanied by a 50% reduction in muscle protein synthesis and a massive loss of strength. Now, immobilization is one end of the spectrum, right? But even injuries that reduce your physical activity can still lead to loss of muscle strength and loss of muscle mass. So although, concerns about weight gain and fat gain are warranted, the ratio of protein and carbohydrate and fat can be manipulated in such a way that we help improve the healing process but avoid weight gain. In short, the reducing of carbohydrates, particularly simple carbohydrates when you're injured, and increasing protein has been shown to help. And so the building blocks of protein are called amino acids, and it's really important that we increase the amino acid intake when we're injured. All right, so enough of the preamble. Let's cut to the chase here. How much protein should you be consuming when you're significantly injured or trying to recover from an injury or rehabilitate? Well, I took this little screenshot from a paper published in 2020, and it may shock you a bit at first, but in the first example, they talk about a 6-foot, 180-pound male who undergoes rotator cuff surgery. And they recommend between 2 and 3 grams of protein per kilogram of body weight. So remember, the RDA is 0.8 grams per kilogram, and this is recommending 2 to 3 grams per kilogram. So this is a massive increase. And since we're in the USA, that would equate to about 0.9 to 1.36 grams per pound of body weight. So this equates to between 164 and 245 grams of protein per day. So to put this in perspective, to get 245 grams of protein, you would have to be eating a ton of protein per day. So if we're reasonable and we just say 200 grams of protein instead of the upper limit that they suggest of 245, that would be 4 eggs for breakfast, a protein shake for brunch, a standard 5-ounce can of tuna for lunch with a 6-ounce Greek yogurt, an 8-ounce steak for dinner with 8 ounces of quinoa, and then another protein shake before bed. In addition, as we age, our ability to absorb and process protein and our ability to synthesize muscle is not as good as when we were younger, and that means that our requirement for protein actually increases as we age. So when we put all that in perspective, I hope you can see that most people are not consuming enough protein when they're injured or they're trying to rehabilitate, or even uninjured athletes who want to improve their sport, or just people who are regularly exercising. But even aside from that, the studies show that regular uninjured people who aren't even exercising are not getting the RDA requirements. 33% of women and 50% of men are not getting enough protein. Unfortunately, we live in a very carbohydrate-centered dietary pattern. And I hope that's the major takeaway that most people get away from this video. Now, before everyone goes out and starts eating a cow every week, I want to touch on some finer points about this with some major caveats. So first of all, safety. There's no legitimate concerns about safety in terms of how much protein you can eat, in terms of the upper limit of how much protein you can eat. Here we have a large position statement from the International Society of Sports Nutrition stating no controlled scientific evidence exists that increased intakes of protein pose any health risks in healthy exercising individuals. They go on to reinforce that statement here, and they even cite studies where individuals ingest up to 4.4 grams per kilogram of body weight. That would be 2 grams per pound of body weight, and there's no issues. Now, one major caveat on all that is that we're discussing healthy individuals. If you have chronic kidney disease or you have diabetes, which significantly affects the kidneys, then you should really talk to your doctor before increasing your protein intake. What the research is pretty clear on is that if you have kidney disease, increasing your protein intake is probably not advised, but in healthy individuals, eating up to 2 grams per pound of body weight seems totally safe. Now, proteins are made of a mix of 20 smaller building blocks called amino acids, and 11 of them our body can make from other proteins in our body, but 9 of them we have to get from our diet. So they're called essential amino acids because it's essential that we consume them in our diet. And of those essential amino acids, leucine is a really, really important one for building muscle. It's really crucial in that role. And the amount of leucine varies in different foods that we eat, different proteins that we eat. So for example, you can get protein from bread. You can consume a lot of bread and get a lot of protein, but the amount of leucine in bread is really, really low. Now, the best sources of leucine are protein shakes that are protein isolates or concentrates, but the best source typically in our diet tends to be animal sources of protein. When it comes to protein powders, whey protein seems to be the best because it's like the most complete amino acid profile, but a lot of people have food sensitivities to whey, so you have to be a little bit careful with that. And we have different options for you here. We've done a lot of research on different protein blends and different protein powders that are out there. So if you're interested in talking about that to us, let us know. But that leads us to a joke. What did the bodybuilder say when he walked into the store and realized that they were sold out of protein powder? No way! Now, plant-based diets have been shown to have significantly lower amino acid profile, particularly leucine, compared to omnivore diets or animal sources. So vegetarians and vegans can still be vegetarians and vegans. They just have to be more careful about choosing foods higher in leucine. And that's not to say that they have to eat a bunch of meat. There's a lot of studies that show that vegetarians and vegans who supplement with an essential amino acid supplementation really do well with increasing their muscle protein synthesis. So we've done a lot of research on good amino acid supplements. So if you're interested, let us know. We can have a conversation about that. And lastly, I just want to mention that studies show that eating protein increases satiety more than carbs and fats. So in other words, you're going to be more full if you eat protein compared to carbs and fats. And then the last thing is that eating protein increases what's called dietary thermogenesis, which is basically the energy that your body needs to digest protein is significantly greater than the energy your body requires to digest carbs and fats. So at rest, you're burning more calories digesting protein than you do with carbs and fats. So the bottom line here is that if you find yourself in our office with an injury and we're trying to go through rehab exercises, or if you're not even trying to go through rehab, if you're still in like an immobilization phase due to injury, you really need to look at increasing your protein intake. You're probably putting a lot of hard work into your rehab or training for your sport. And if you don't have the nutritional support for muscle protein synthesis or tendon collagen synthesis or bone rehabilitation, you're putting a lot of work into your rehab, and it's not going to give you the optimal results that you're looking for, and it'll probably take a lot longer. Now, at this point, given the limited knowledge that I've given in this video, I wouldn't expect anybody to be able to dial in their nutritional needs perfectly based on their exact individual needs. This idea of protein is part of a larger category of macronutrients, which includes fats and carbohydrates and proteins. And the way we dial in our macronutrients depends on a lot of factors, including our age. We already talked about that, what medications you're taking, different lifestyle factors, your level of activity, and then other health conditions as well. They all play a role in our macronutrient intake. So we're here to help you put all the puzzle pieces together like we did for Sam, like I talked about earlier in the video. If you think nutrition is important for injury recovery and sports performance, give us a call. Tell us that you want to have a conversation about your individual needs, and we can have a nutritional consultation. We can also help you put everything together with protein powder supplements, because like I said, those depend on individuals, or branched chain amino acid supplementations based on your needs so that you can maximize the results of the effort that you put into rehab and training for sport and exercise. All right, take care.